Graduate of RNC. Right. Assalamu alaikum and good afternoon. We are going to start, and we will mute all at the moment, but you can unmute yourself whenever you want to say something. The other is that you can write the questions in the chat, and we will collect the questions and can answer. Or you can keep your answers towards the end and we can discuss that. Because we have only one presentation, so we would have enough time to discuss all kind of questions. So let us start our session. It's already. Okay. All right. Assalamu alaikum and good afternoon again, everybody. Thank you for joining, taking time to take part in this webinar. This is the fourth webinar in our series of MEDED webinars, and today, as you see, we will be talking about online assessment methods. So let me begin with the quote. That students can, with difficulty, escape from the effects of poor teaching. They cannot escape the effects of poor assessment. Imagine if a student has been failed not because of his inability, but because of the system, the price that poor guy has to pay for that. Now, what are we going to achieve out of this session, our learning outcome and a plan of presentation? Yep, you can hear me. Can you hear me?
Yes, yes, Prof.
Yes, yes, we can.
Prof, we can hear you.
Yeah,
Yes,
okay.
we can.
And you can see the screen as well.
Yes, of course.
Yes. Yeah, okay.
Yes.
Right. So our learning outcome for this session, the first one is that the participants of this webinar will be able to select feasible, fair, cost-effective online assessment tools, utilize the existing facilities and tools more effectively and efficiently for online assessment so that we can cut the cost. And third, conduct online assessment using appropriate tools. We would be conducting a very short.
Prof,
Yes?
just interrupting you. Should you record the session?
Sorry.
Record.
Yes,
that's already on recording.
Yeah, I'm recording it. Yes.
Yes, that's already on recording.
Yeah, I'm recording it.
Okay. Sorry for interrupting.
Yeah, that's okay. So we would have a short hands-on activity on online assessment during this discussion. And the scope of this presentation is, one is that we will be addressing the immediate concerns and as well as planning of online assessment in future. There are few disclaimers. Not all the ideas, suggestions presented in this webinar are evidence-based because some of them we have not tried yet. Before using any method or software, a trial run must be done to train the staff as well as students. And any teaching learning activity or assessment method that require hands-on demonstration of skills cannot be fully replaced by online approach. The principles of online assessment are actually more vigorous than face-to-face assessment. Of course, the validity of questions and assessment is there. The feasibility, there has been a lot of discussion on reliability at this stage because teaching and learning has been compromised to some extent. So whether our assessment should be based only on pass-fail criteria or should we go for grades? So that's one question need to be answered. Feasibility. We should divide the exam components into two groups, one which are doable online and others which are not doable online. So especially under present circumstances, and the ones which are not doable online, we should defer them till the students are available and we can do face-to-face. The online assessment can be online or it can be offline as well, that if we ask for electronic assignments. Similarly, the online assessment can be on the campus or can be remote, and in this presentation we are talking about remote online assessment, and this mode has different requirement than having online assessment on campus. Those medical schools who have international students, they have to think of time zones as well, because they have to choose an appropriate time which is suitable for all the candidates. The next one is fairness, which is another important element here, that all the candidates must have comparable facilities like internet or bandwidth. So we should choose methods of assessment which require minimum requirement so that everybody can use those facilities. And then it is very important that the candidates must be familiar with the approaches and methods and technology which we are going to use. And the assessment must fall in line with the teaching learning methods, especially if we have been teaching in a different way and now we are planning to assess online, then we have to think that our methods of assessment are in line with our teaching learning approaches previously. Academic dishonesty is again a major issue and being discussed everywhere, and we will see how we can go about it. Students should not be able to use any additional functionality of the computer other than the examination itself. The cost effectiveness is more the students, less would be the cost. Legal cover is important. Our method of assessment must be acceptable to stakeholders and especially the accredited bodies, because if we want to give a degree, our assessment must be acceptable by the relevant authorities. Then implications of online assessment, especially in future, the advantages, new and enhanced type of questions, and there are some disadvantages, as I mentioned, dishonesty and the cost. Robustness of the software is very important. Technical cover. Ability to recover from a technical failure is one of the key issues of conducting online exams. So the software, whichever we are using, should be capable of handling, and we will be addressing this issue in our presentation. Impact of teaching learning practices for future consideration. And online assess, again, I repeated this previously also, just we must realize that online assessment cannot completely replace face-to-face assessment, no matter how good we are at it. Now, coming to how we should plan the assessment, the first part would be before the examination. So prepare the staff and the student for online method of assessment. If students and staff are not familiar with online methods of assessment, we must create an opportunity, maybe a mock examination or some summative assessment, where both staff and students become familiar with the method of assessment. As I mentioned in the first slide, that nobody should fail because of the not being familiar with the system and not because of their inabilities. During the exam, now, whatever material we are using, it's better that we use the original material and not from internet, because most of the students would be familiar with all kind of the materials available on the internet. So try that we use original material from our own cases, our data, our videos, our ECGs, our radiographs. And after the exam, if we are talking about a particular student, we should compare the results with the previous assessment of that student, may be formative and ongoing, so that we know that whether this assessment is in line or similar to the previous one, or is it significantly different. And if we should check for plagiarism, especially if we are doing essay type of questions. And we can have viva voce for outliers, means those students who have extremely good result, are those students who have extremely poor result, are those students who claim that they had problems with the internet. So that group of students can be interviewed and reassessed. I think this is an important security step which can help us to conduct a fair examination. Now, assessment components, typically we know that there are cognitive, psychomotor, and affective domains. There is a written examination. There is a practical or OSCE, or clinical or OSCE, and then viva or oral presentations, which Higher Education Commission of Pakistan is also recommending. Then there is personal professional development and ethics. Ethics, lifelong learning, evidence-based medical practice, communication skills, teamwork, or entrepreneurship. Now, we will talk about each of these modalities of assessment one by one. And here I'm making a proposal, and this proposal would be tested later in the activity. For example, we want to do the multiple choice question, modified essay questions, or structured essay question, or open book examination, means the written examination. So proposal is that we divide the students into groups of 20 or 25, and each group is assigned an invigilator. And then they are assessed on Zoom with whatever software we are using for assessment, along with Zoom. And then we keep the camera on and the mic unmuted, so that invigilator can have a look and monitor and invigilate those 20 or 25 students. So this means this would be one group. If we have 100 students, we can have about, let's say, 4 or 5 such groups, which can start the examination at the same time, but they are working as independent units.
Elisa.
The online projection of questions on the spot. So what we will do in our activity, we will show you that how we can project the question on the spot, so that the examiner has a better control over questions than the students. And then we can have a submit button after every question or after a section of questions. So students, once they submitted the questions, they cannot go back. We would move on from question to question after a fixed time. And with this, we can add videos, images, and sounds, because that is the major advantage of online assessment, and we should take benefit of that. And it should have an automatic marking. As I said earlier, that we will be having a short hands-on activity on this proposal in a short while. The open book, and no, it's not just open book, it's an open web approach. And if we want to do that, which is being recommended by many authorities, but if students and staff has not been trained previously, then we need to organize some kind of training, maybe one-day workshop involving students and staff before we actually use this platform for examination. And as I said earlier, that in this situation especially, we should avoid using materials which are available on the internet, and we must check for plagiarism using different softwares, as the essay type of questions can be checked for plagiarism. Assignments can be submitted, of course. Projects can be submitted. Literature reviews. This is another way of looking at the student's ability, especially if modules on research are part of our curriculum, right? Some topics like vaccines for malaria, dengue, or latest modalities of treatment. So are topics where they really need to search the literature and come up with some write-up. To enhance the content validity, following additional features can be added to online questions. We can add, that's the biggest advantage of online assessment, that we can add animations, videos, and sound. Hotspot questions. Now, one of our colleagues wrote me that they want a bit detail on this. What is the hotspot question? I'll explain about it. It's which require the students to identify a structure by placing a mark anywhere on an image or a diagram. So let's take an example of let's say it's a hematology slide, and we want the students to identify, for example, the target cells, or teardrop cells, or any abnormal cell in that slide. And for picking up that cell by a cursor would be the hotspot. So it is actually recall and visual assessment, and this visual assessments may not be possible by using MCQs or other text-based assessment methods. But using this hotspot technique, it can be used on slides, on photographs, even on gross specimen photographs, and where we want to ask them to identify that structure. So this is what is called hotspot questions. Then we can have, in the same picture, we can have a photograph, and we can have the labels on the one side, and the software can help us to use those labels to identify that particular structure. So this is simply dragging the label from the side and putting on that particular structure would, again, it's more of visual and recall assessment. And then is the simulations. Now this is another software and other called Close, and this is basically revisiting our old method, which the fill in the blanks type. And again, it is basically a pure recall of information. close is the technical term for inserting deleted words into a section of text in order to complete it correctly. And or this can be further used in let's say, missing points in a flow chart. So if it's a flow chart or a diagram and some parts are missing, and students may be asked to fill into that. So these are some softwares which are available online. They are free, and they are really very useful. I have tried few of them. The last one, ExamNet, we have tried, and I think it is very useful if we are using, want to assess the essay type of question. It may not be appropriate for multiple choice questions, but if you have essay type questions like structured essay questions or short answer questions or modified essay questions, then this is very simple. It is free for 2020. And maybe next year they would start charging. So, and you really don't need a lot of practice. It's very simple, and you can learn it very quickly, and students can also learn very quickly and can be used. Now, the activity I was referring to, now, what first is the, now this is the checklist which is for me and as well as for you if you want to use it in future. The process is that we will send you a WhatsApp link. You will click the link and you will get an answer script. And then in answer script, you have to fill in the some basic information. Once you have done that, then we will project the question on the screen, and you have to answer those questions on the answer script, which is on your WhatsApp. You can use your mobile phones for that. And after you have answered, you have to press the submit button. And then we will receive your answers. We would analyze and we will show you the results. Can we send the, so we are sending you the link on the WhatsApp. Please check your WhatsApp in the group OA webinar 4. See, you have received a WhatsApp.
No.
Can you please confirm those who have received the link?
Yeah, Prof, I have received it already.
Yes, we have.
Okay, good. Now, please,
We have received.
please click the link. And if once you click the link, there would be an answer script, and you have to give some information. And we have said that for identification, maybe you can use your mobile phone number.
Prof, is this only one page, question 1 and 2?
Yes, there would be 2. Page maybe just 1, but there are 2 answers.
Yeah, 2 questions I have
Done,
seen.
sir.
A, B, C, D.
Yeah.
Yes,
So-
sir, done and submitted.
Sorry?
Done and submitted. I have submitted.
Oh.
No.
Not yet.
Not yet. You have to see the questions first and then fill up. You can click it again and probably you can get access to that. So everybody has entered the basic information.
Yes, we have, I think.
I do not receive. Where to receive? In the group?
We got 10 responses from the participants without looking at the question, and they have pressed the submit button. Maybe we will send the link again. And those who have already submitted, please use the new link.
Actually, it's only the phone number, the hand phone number, and 2 questions answers. There is no question.
Yeah, the questions I will project.
Yeah, but when I press
just hold on, sir.
Wait.
I will
Oh, sorry.
I will project the questions, and then you would read the question and you would enter your answer in the answer sheet which you have just received.
Okay, sir.
sir.
Sorry.
Hey, Prof, these are 2 questions only. If we want to add more questions, can add to this, this software?
Yeah, you can have even 100 questions. It is just an example.
Okay.
Yeah, it's just for practice and to demonstrate. But in real practice, we can have as many questions as you want. So everybody has entered the personal information?
Yes.
Okay.
Yes.
Now,
Yes, sir.
We do not receive yet.
sorry? Sorry?
Did not receive the link.
Oh, did not receive the
Could
link?
you put in the chat?
There is no, did
You
not
go to the-
receive any link.
You have to go to the WhatsApp. Go to the WhatsApp.
The
And
link
I am in the WhatsApp. It's not available.
It is on the webinar 4.
But
And the
if
Oh,
if
form.
sorry, if you have not registered and your name is not in the registered group, then you wouldn't get that. So
I have put in chat, sir. I have put in
okay.
the chat box for you.
Okay, let me do it. So somebody is very kind and has put up it in the chat.
Okay, thank you.
You see how many good friends I have. Okay, so the link is in the chat group, and please, so I hope everybody has entered the particulars.
Yes, sir.
Now, when we are doing it, actually we have to make sure that camera and mics are on, but because here the number is much larger, so it may not apply in this situation, but in real situation it has to be like that. Now I will project the question in a short while, and then you have to answer that questions because each question would be given 1.5 minutes. So there are 2 questions. You would have 3 minutes to answer that. And once you have answered, you will press the submit button. And we will show you the results towards the end of this presentation. So this is the first question. In Wuhan, China, researchers looked at a case study. Is question?
We can't see. Okay, now we can.
Yeah. Prof. Samina, can you see the question on the screen?
Yes, sir, I can.
Yeah, okay. Thank you. So let's monitor the time. Don't worry, I'm not going to test your knowledge. It is just an exercise for practice.
For
One and a half minutes seems to be too
Sir,
long.
it is single answer or multiple
A
correct
single
answer?
answer. So I think the system would not allow you multiple answers, single. So now is the next question. A 70-year-old man.
Prof, can I say something?
Yeah, sure.
Sir, the questions that you are displaying right now, it's in the format of the PowerPoint, isn't it?
Yeah.
So that means the paper that, for example, MCQ type, we would develop.
Prof. Loach, we will discuss it later. In examination, no extra discussion, please.
Okay.
You are a candidate now.
Sure.
How much time left? 20 seconds to go. It says 82 here. 70 people so far have submitted, so you have another 10 seconds to submit. Please, after you have answered, press the submit button. Click on the submit button. Okay, and after you have clicked on the submit button, please unmute yourself before we go for rest of the presentation. Okay. Okay. So let's move on to the rest of the presentation, and we will share these answers at the end of this presentation. Okay. Now, so far we were talking about the written examination, and the next section we are going to talk about practical and clinical examination. For practical examination or OSPE or OSCE, we can use pictures. We can ask students to label those pictures or identify abnormal structures. We can use data and ask them to plot the data and interpret the data like growth charts. We can use statistical analysis. We can have demonstration live or video, and where we can ask students that where the person who is demonstrating has made a mistake. And we can use videos for diagnosis, description of abnormalities. I will give examples of each one of this. So let's see, for anatomy purpose, if we are using pictures, we can ask for identification of structures and ask the related questions. We can give abnormal pictures like Erb's paralysis, kyphosis, and lordosis, and can ask which nerve or which vertebra is involved. We can use abnormal chest pictures as well. We can use histology slides. That would be a good way of assessing histology online. We can use radiographs, bones, fractures, cardiac shadows, lobes of lungs, fissures. Ask the student to mark that. Or we can use videos of different movements, normal and abnormal, and can ask which muscles were involved in such movement. And we can even use some videos on dissection and ask them to identify the structures. For physiology, biochemistry, pharmacology, we can use different graphs and ask them to interpret. We can have data and finding interpretation. We can use flow charts, and in flow charts there may be some missing points, and ask them to fill in that, or draw a feedback mechanism in a patient, for example, with hypothyroidism. We can use videos, animations. For example, we can use slides with RBC morphology, thrombocytopenia, or abnormal WBCs, and ask students to identify that. In microbiology, we can use pictures of microorganisms or gram staining. we can use culture plates or mediums, or slides like malarial parasite or bacteria. In pathology, we can use pictures again, identify the gross abnormalities, or slides of pathology, for example, a slide of urine microscopy looking at the RBC casts. This is one example. Using this slide, we can use a scenario with a person presenting with fever and maybe ask what is the most likely diagnosis. We can ask them why they have come to a diagnosis, or we can ask them about these ring forms of malarial parasite. That is something good about the online assessment. Like the example here, we have the heart pictures with one VSD, and then we can ask them to fill in the pressures and oxygen saturation in the chambers of the heart, so they can compare normal with abnormal, and then can give figures about the pressures and the oxygen saturation. The hotspot, which I mentioned earlier as well, is the image hotspot type of questions are good at assessing visual knowledge that would be difficult to achieve through MCQ or other textual question type. There are no visual cues as to where the correct answer lies. So previously, like I mentioned, the example of a slide, and we can ask them to identify a particular cell and just drag the cursor and click on that cell. We can use pictures of gross specimens, slides, and photographs for this purpose. So that was practical. Coming to OSCE and the objective structured clinical examination, of course, it would not be possible to have hands-on demonstration here. So this would be a bit of compromise there, but we can still find some ways to do it. We can use the growth charts and provide the data and ask the students to plot the data on the growth chart and then interpret the data. We can use pictures with the facial features like Down syndrome and thalassemia, and we can ask them to identify the features, and then the rest of the questions can be based on that. Like again, marasmus or Kawashiorkor, their pictures can be used. Nephrotic syndrome, eye changes. Let's say the retinal changes or fundus pictures can be used. Goiter, hypothyroidism, cretinism, gynecomastia, abdominal distension, ambiguous genitalia, rickets, bowing of lower limbs, swollen joints, achondroplasia, talipes, purpura or ecchymosis, and skin slides. These are few examples. I'm sure you can think of many more which can be used for online assessment. Here, for example, a picture of a child with clearly a cyanosis can be seen, and from this we can generate a number of questions which students have to answer. So although the big chunk would be cognitive, but there would be some clinical identification as well. And if we can combine the pictures, like for example, this child with cyanosis with this X-ray, so that would give us a picture, for example, of tetralogy of fellow, and we can ask them, okay, this is the picture of the child and this is the X-ray, and what is the most likely diagnosis, and then we can move forward from that. Similarly, we can give the scenarios of respiratory symptoms along with these X-rays, or maybe the auscultatory findings as well, and ask them to interpret and come to a diagnosis. And from there, we can generate some more questions. Skin slides are the best to assess online, and again, we can generate number of questions based on that. All right. Then the videos, I think that is the best part of online assessment. Using videos, we can have videos of gait problems, fits, epilepsy, abnormal movements, tremors, physical examination illustrating signs like cranial nerve examination, facial palsy, and brisk jerks. And then we can ask questions on description and interpretation of these signs. Again, we can use videos of the patients, especially the communication, for example, doctor-patient interactions, procedures, consultations, and communication. They all can be used to create appropriate assessment scenarios that have very high content validity. We can add sounds. That's again an exciting part of the online assessment, maybe cardiac murmurs. We can use the respiratory sounds, crepitations, rhonchi, wheezing, stridor, or even whooping cough, right? So we create a scenario, and rather than describing the patient, we can just add a video and can generate questions on that. This is, some people have used, I got a report from Singapore that because they had a small number of students, so they called them of course, with the permission of the authorities. And the students were sent into the clinical skill lab where they, but they were being observed by the examiner in a different room. So they were asked to do certain examinations, and that was being projected, and the examiner was sitting in next room or other room and looking at that. So if we have a small number of students, that can be another way of assessing the clinical skills. Now, interview and the communication, again, we can use simulated patient, but I think better that we can use real patients. We can talk to some patients, and we can have a Zoom session, for example, between patient, student, and the examiner, and students can have the, we can give scenarios, or student can be asked to take history, or they can have the counseling sessions or ethical issues, or we can even assess the prescription writing after, let's say, interviewing the students, what they can offer to the patient. This is another software. It's Docs and Drugs. It's an old one, and here the student plays the role of a physician who has to deal with the patient who presents with a clinical problem. This is basically a form of MEQ, which can be done online. And in fact, if you are familiar with MEQ, for MEQ, the best format is online assessment, because in that we can add so many things. Like I said previously, the pictures, the videos, the X-rays, the ECGs, so many things can be added. And I have always been looking into the possibility of using online or computers while administering the modified essay question. And I think this is a very good opportunity. Now, first part we talked about the written examination, and second part was on practical and clinical assessment. And of course, as I mentioned earlier, there are limitations. We cannot have hands-on skills, and probably we need to identify those, and those can be tested later on. There has been instances where students have been promoted with subject to clearing the exam, the hands-on assessment, which would be administered when they come back. So that is another way. So as I said earlier, that we divide the elements doable, online under the present circumstances, and those which are not doable, online, we can do it later, and the students' promotion can be subject to their performance during that assessment. Now, the major question, the very big question about online assessment is the exam security. So how to do it? There are a few ways to follow. The flow of question is controlled by the examiner and not by the students. Like we just did, I hope nobody got a chance to cheat during this examination. And if we have a control over the questions and we can control the flow of questions, and on top of that the camera is on and the mic is on, so there would be a lot of invigilation and proctoring, especially when I said that we make a small group of 20 or 25 students and one person is invigilating. So that is one way. Second is just sufficient time for answering, a reasonable time for answering, and then we move on. Students do not have access to the answered questions, and we know that we have already been practicing, especially in modified essay question. Once students have answered a question, they cannot access that component again, and that can be applied to other modes of assessment also. Invigilating, as I said, by using camera and mic, and then tallying the results with the previous assessment of the student. We have the previous record of the student, and we see whether it is, let's say, too high for that. And if that's the situation, then we can conduct a viva for those particular group of students where their performance does not tally with their previous record, or they have faced some internet disruption. So we can conduct viva based on the similar type of questions and come to a reasonable conclusion. If the assessment is in form of essays or even MEQs, we can use the software to check for plagiarism. Now, in this table, you can see the different types of online assessment in relation to the Bloom's taxonomy. So from remember to the C6 level of create, we can have number of options which can be used to assess the students. Each one of you have got this slide, so I don't think I need to read the whole thing. And you can think of many other possibilities. This is not an exhaustive list, and there are a number of other ways available. Now this is what I labeled as thinking loud. You can think of whether they are possible. Of course, there are a number of restrictions. There are cultural issues. For example, asking students to prepare videos of a different kind of examination, either on a family member or another student. Let's say if students are allowed to group in 2 or 3 members, so they can perform examination on each other and then can send a video for assessment. For one example is like examination of clinical nerves. The skills such as suturing can also be video recorded and assessed. Again, although it's a bit expensive way, but there are some centers who have conducted, especially those with small number of students, have conducted the clinical examination using personal protective equipment, both for examiner and the student, and to get that hands-on in that particular situation. So if we really want to do that, that is one option available. The advantages of online assessment: there are advantages to the students. Easily monitor their own academic progress by means of formative assessment with feedback. Basically, this is looking at the bright side of assessment. Now we are forced to do online assessment, so we can take advantage of the benefits. Answers can be entered or altered quickly and clearly. Assessments can be modified to accommodate special needs, and interactive, adaptive, or adaptive and multimedia question types can be used. For academic staff, questions can provide more valid and holistic way of assessing knowledge, can monitor the assessment of students to give personalized feedback, interactive, adaptive, and again, multimedia question types. And for administration, the fast marking and scales well with the additional examinations for a large number of students, because most of the software you use would have the automatic marking except the essay type of questions, and of course it would save paper. Right. Disadvantages: it can be expensive, although at present there are few softwares which can be used free of cost. But if we want to do it as on permanent basis, then we have to have assessment system software license. We have to have powerful servers, a large number of computers, and staff training and staffing for that purpose as well. Physical environment would be required for maintenance of this hardware. We would need to give training to the students as well as to the staff, and the staff must be trained on how to enter questions and utilize capabilities of the system. And risks are, as we said, the external hackers, viruses, our internet staff, our student security policies, and failure of power, hardware, or software. So those are the disadvantages of this. So I think that is looking at the online assessment. This is a graph which shows what is going on or what has been going on around the globe, and this is a survey done by UNESCO. And if you see that the large number of institutions, they have changed dates of their high-stake examiners. The dates have been extended. Introduce remedial courses once the school opens. So where the teaching learning exercises has been compromised, so that need to be looked into. Reduced student learning contact, organize the summative assessment online, introduced alternate way to high-stake examiner. And if you see, it has affected both developing and developed countries. So we all know that this is an international problem, and different nations have been dealing with it differently. Okay, now the time to show you the results of your excellent performance. Need to escape. And so here it is. Okay. So 96 responses. Oh, this one I can move. And I can close this one, right? Okay, now 96 people have appeared in this exam. So average marks is 5.36. 5 is the median. So just enough to pass the exam. Yeah, the same thing in the graph form. And then this is for question 1, the C, the right answer, 51 So 53.1. Then D was the right answer for question 2. This is overall, but we can see at the individual level as well. And so if you see here, the luckily this side is blocked, so you don't see who is this candidate. But we can see for every student, we can see their total number of marks, and this is automatically marked, and we can see it very, very, very quickly. So that is one example, a very simple example, using the existing facilities. You don't need anything extra, but can conduct an online written assessment without spending much resources. So I think that has demonstrated the point. Can I close it from here? From here. Okay. So the okay,
Sir,
now
so,
it's open for questions or for comments.
Of how to prepare this answer script?
Yes.
This is a simple Google Sheet. The Google form, it's not difficult. It's free of charge, and with very little practice, you can do that. It's a Google form, which I think many of us are quite familiar with it. These forms are also used to conduct surveys, etc.
Right.
And it's free of cost, available online from Google.
So it is from Google. It is free of charge.
Yeah, it's free of charge.
Okay, Purab. Another thing regarding the Viva examination, you
Right.
told that it is needed for those who have done extremely good result, or who have done extremely very bad result, or
Right.
those having some internet problem.
Right.
Now my question is that those having extremely good result, if on Viva examination it is found that his performance is not good, so can we reduce the number? Can we reduce his marks in that case?
No, sir, it is your policy. You know, I know that many medical schools, when they want to give distinction to their high performing students, they conduct their Viva. So it is the policy of the institution what you want to do to that. But the reason I'm suggesting is that if it is extremely high score for a student who has previously been, let's say, not so good. So this would be your assessment that indirectly to tell us whether that student has used any unfair means to answer those questions. The Viva can be related to similar or same type of question to assess the student's capability. So I'm sure that the institution can decide that if this student, although has so good marks in written examination, but when we have a Viva on the similar questions, a student is not performing well, then the school exam committee or they can decide whether to reduce the mark of that student.
Yeah, thank you.
Sir, I have two questions regarding security. Can I ask, sir?
Yeah, sure, please.
Sir, my first question is that we can, on camera, we can only see the face of the student, not what's in his hand, or student can consult mobiles and the books while answering the question. How we can avoid this thing?
Okay, let me answer this first.
Yes, sir.
One is that we are using the camera and we are using the mic. The other is this software. For example, I was mentioning to you the ExamNet. If a student moves away from the screen, the system would close. So many of these softwares, they have inbuilt security system. So if student is not is away from the screen for a few seconds, the system would close. And if student wants to get out of that screen, the system would close and student would not get access again. So,
Sir, even even with while staying on the screen, he can use the mobile.
Yeah, I mean, I'm not saying this is foolproof, and even in real examinations, in spite of all half a dozen invigilators going around, students can still cheat.
Yes, sir.
So I'm not saying that this is foolproof, but this is what we can do under present circumstances.
So may I make a comment?
Sir,
Sure,
yes.
Yes, other question, madam?
So may I make a comment?
Let her finish her question, please.
Sir, my second question is like, what if students sit together to do this online examination? Like all 3 or 4 students sitting in one room, they can attend this online examination without letting us know that they are.
Yeah, I mean, that's where our mic would help. If students are talking, the mic can pick up. So that again, that is the maximum we can do about it.
Sir, Assalamu alaikum. This is Dr. Aisha Abdullah. Sir, can I ask a question, sir?
Sure, please.
Sir, in fact, these are 2, I would say, submissions. One thing, all these questions that are being raised and the issues that we are facing of security and all that, that is these questions are coming because of the basic philosophy that we have behind all exams. We take our exams like a big bang.
Right.
They are not the if we were more into continuous assessments, we would not that big bang exam at all. And all the issues of cheating, if the environment had context validity, all our exams are irrelevant to the context of what these students would be practicing later on. When we practice in a relaxed environment.
Right.
We do not have all these swords hanging around us and people and being aware that people are watching us.
Yeah, madam, I agree. Madam, I agree with you more than 100%. I am always of the view, if our continuous assessment is solid, is reliable, is valid, actually we may not need these extensive examinations, exit examinations. But now we are talking about a situation where we do not have this continuous assessment in our hand, and we have hundreds of students who have gone through the previous setup, and now there is a critical question of promoting them. So, but if as a policy,
yes, sir.
I fully agree with you.
Yes, sir. And the second thing is that what we have been practicing, as you said, continuous assessment. We have a very strong system for continuous assessment, but still the legal requirements are that we have to take a summative assessment within these parameters.
Yeah.
So when we took the our clinical OSCEs in these clinical rotation clerkships that we have that were left out during this period,
right.
We did not keep it time bound.
Right.
And that the reason for that was that some students take more time in getting acquainted to the these virtual environments, and we are actually assessing their clinical competence. So we give them time till they perform that skill. And as you said, different people are trying different things. Besides this SP being from the family or any other one that the student brings, and we ask the student to put a mask on the SP of on the SP as well, so that their identity is also protected. We ask
Right.
them to put on draw an abdomen over a pillow and show us the palpation in different quadrants as well, because
Right.
if they don't want to have an SP, so different things can be.
Yeah, that's an interesting. That is an interesting idea.
Yes, sir. And the most important thing, sir, that from my point of view is that when we are planning all these assessment and we are talking about them, we are not taking the context of the student in mind. And
Sorry,
that context
sorry,
is that this.
Your voice is breaking. Sorry.
So the context of the students for virtual exams
Right.
and the proctoring, what impact it is going to have on their minds, that they are being policed like criminals.
Madam, you are absolutely right, and that is why I think I emphasized on the training, that before using any new method, we must train the students and we must train the staff. Now, we have to realize that we are not talking about normal circumstances. We are talking about an emergency situation and how to handle it. So these are extraordinary situations. Yes. Any other question, please? Anybody?
Can I say something?
So can I say something?
Yeah, please.
I
Yeah,
have a
please.
question.
Yeah, please. Professor Bloch, yes, please.
Yes, so thank you very much, sir. That was a very informative presentation. I have one question and one comment. Comment if you would like to hear that.
Please. Yeah, please.
One, sir, I just wanted to know that what could be the format of the MCQ and MQ, like you have taken that the PowerPoint perhaps.
Right.
So you mean to say that as an examiner, for example, my subject, whatever my subject is, I will prepare a paper and display on that of the PowerPoint. My comment on that online experiment. I myself have conducted online examination on a canvas. Probably everybody knows about the canvas.
Right.
I found very good results.
Right.
It's a very cost effective, it's almost free, and the students can log in on their academic emails.
Right.
And it has got all resources that you have talked about, and very, very, kind of a almost foolproof environment we can do that.
Right. No, the Professor Bloch, my point here was just to show a demonstration. I'm not advocating one software to the other. My whole purpose was to demonstrate that we can conduct the online assessment even by using simple presently available facilities. But of course, that I have given a list of software as well, and there are many more others. Every software might have some their advantages and disadvantages. But my whole point was to demonstrate that it is possible with little bit effort. But of course, I'm doing it a very simple way. If you use software, they would have a number of additional features. Like I said, for the one I used for my students, the ExamNet, and as soon as students move away from the screen, they were logged out. And the students complaining to me that they simply looked at the other side and they were logged out. So there are softwares who are quite useful in that, and most of them are freely available. So we need to simply look around and find out.
I have a question.
Yes, please. Please unmute yourself if you want to ask the question.
Yes, I have a question.
Please.
In your opinion, which one will be the most appropriate software for taking Viva?
No, Viva you can take on Zoom. The one we are using now. One-to-one. You don't need any additional software.
Google has not given any facility for taking Viva.
No, it's just like you and me talking. So on one side, the examiner is, and the other side, the student is, and you can ask the question and student can answer the question. You don't need any special software for that.
So can be in Skype, Prof?
Sorry?
Skype?
Of course, can be Skype as well.
So can I comment something?
Yeah, sure, please.
Sir, I'm Dr. Rafia Minhas and I'm teaching in Avicenna Medical College, and I recently had the opportunity to give my online exams of MHBE via our VLE. And
Right.
what I would like to share with everyone over here is that you can have the security, and the question asked by Dr. Iram Iqbal was very good, that how can you decide that, how can you know that there is only one student in the room, even 3-4 students may be sitting, and how you can check is that the exam you are conducting on BLE or on Google Form or any other sheet that you decide, and after simultaneously you can have Zoom downloaded on your mobiles, and ask the student to give you a 360-degree view of the entire room. GRE is conducting home exams. They are not taking exams on sites because everything is locked down. So they are doing like this. They have a Proctor software that they use. They pay for that. But we cannot do that. We are using Zoom in order to get the 360-degree view. And the ExamNet that you have mentioned is very effective, because the moment a child is away or he tries to Google something, your site is locked and you cannot re-enter.
Yeah, I agree. The number of actually the ways of monitoring. At the same time, we should realize that none of this is foolproof, and even in our usual exam face to face, there are instances where the cheating can take place. So these are some things which we need to accept.
Excuse me, sir, I have a suggestion.
Yeah, please.
Most of the institutes, I'm from University College of Medicine, most of the institutes are having online MCQ based assessment of undergrads.
Right.
So in that assessments, like we are advised to make C2 or C3 level MCQs, so that the student has to process that information in mind and then respond to it in a given time, like 1 minute, and he's not given this simple rote learning type MCQs, which can be easily typed on Google on an alternate laptop or on a cell phone, so that his siblings cannot help him in answering that question that we may expect in setup. So this type of questions may discourage cheating and may produce a transparent result.
Prof, it is interesting that teachers are struggling and trying to be a step further ahead of students in all these exercises. The point you said that of course the rote memory questions we are not recommended even in face-to-face kind of examination, and personally I find that let's say the single best answer question which I showed two examples here is the extended matching type of questions, and probably the best is for clinical years, the best is modified essay question, and in those modified essay questions you use real patients. You don't take it for internet, so they are novel situations for students and they have to think before giving any answer. So in fact we would be talking about C4 and C5. In fact I attended a discussion, and the lecturers were talking that because of this, in fact the lockdown, and because they cannot do the clinical, many of them have taught theory quite in extensive way. Sometimes these sessions have been repeated. So probably we should be asking higher order level of cognitive questions rather than basic. I fully agree with you on that.
Thank you, Professor.
So, and this, I mean, the level of question, it doesn't matter whether we are talking face-to-face or we are online. The validity and reliability and the level of the question is, of course, matters in both situations. Yeah, any other questions or comments?
Sir, I want to share my experience, what happened yesterday.
Sir, will you
what happened yesterday, I
stop the
received a
share of the
message from
screen?
one of
One by one,
on one of the can you
yes,
hear me?
madam, can you repeat what you are saying?
Hello.
Yes, please.
Could you
Hello?
stop the share of the screen so we can see all other?
Actually, I have something else to share a bit later also. Okay, all right. Okay.
I have a question, please.
Thank you.
Yeah, okay. Yes, please.
Okay, sir, I have a question.
Yes, Dr. Khola.
Mentioned
Yes.
that on Zoom we can have a 360 degree view of.
Can't
My
hear
question
you.
is regarding somebody among the participants mentioned that. Okay, sir. Am I audible now?
Yes, please.
Am I audible, sir?
Yes, I can hear you.
Hello. Can I speak, sir? Okay,
yes, please.
Sir, I have a question. Somebody among the participants. Okay, sir. Thank you very much, first of all, for such a nice presentation. It was really very informative. Sir, I have a question. Somebody among the participants mentioned that we can have a 360-degree view with the Zoom. So
Right.
I just wanted to ask what is actually the quality of that 360-degree view, because Zoom has lots of connectivity issue with regards to audio and visual. So is it a clear 360-degree view to take the exam, high-stake exam, or things like that?
Yeah,
Thank you.
would somebody like to respond to that?
Yes, sir. I'm Dr. Rafia, and I was the one who mentioned this 360 view. Thank you, Dr. Khola. My dear, for taking a high-stake exam online, it is very important and very essential that you have to have a very high-speed internet. Otherwise, your students will suffer and they will face many glitches. While I was undergoing my examination, unfortunately, I had internet issues, and 20 minutes of my time was wasted because I was unable to log into the VLE, although my Zoom was recording it online, because my Zoom was on the mobile, but my laptop was not connected on the internet. So what by 360 means is that if you remember the 360 from mathematics, you are giving a whole view of the entire room. You take your mobile in your hand, your Zoom is connected on your mobile, and you are requested by your examiner or your teacher that you have to show the entire room. And once the room is up to your satisfaction, this you have to do before taking the high-stake exam. And once you are doing it, you can even add 5 minutes or 2 minutes breaks in it, or even you can ask your student if you suspect something, then you can, because on the Zoom, the teacher will always be there and the student will be being monitored on the Zoom as well. So you can, if you suspect something, you can ask your student to show the 360 view or the entire room again. I hope
Yeah,
that's
in that context, yeah, I got help here. There's a suggestion that some software, they track the IP address to ensure that no students are together. So there are certain softwares which can help in that respect. I realize, and I think every one of us realize, that security of the exam is a big issue, and everyone is trying their best to handle that under the whatever circumstances we have. And I mean, if we have to use this, we have to try our best, but we have to settle down whatever is can be done, or whatever is available. Right, but nobody is underestimate this.
Thank you very much, Dr. Rafia.
Yes, Dr. Abdul Karim. Yes, please.
Yes, Prof. Alam Sher Maulik. It was a very nice presentation from you as usual.
Thank you.
I have got some suggestions for this problem. My university has suggested to use another web camera on the handphone, and both devices must be on throughout the examination. So the laptop and the Zoom is mainly for your face, of course, yeah, because most of the times we are able to see the face as many of you have suggested. But the other device will be giving a complete picture of the table on which the candidate was sitting and his hands and these things. So the camera will be focused so that the entire table on which he is sitting will be always on the screen. So this is one method my university has suggested. And we can also ask the student first to show the entire room and then close the room. So so we will see with our own eyes that the room is closed and nobody should enter after that, and no conversation or no discussion. So these are some of the precautions. But I heard recently there is one device, but I forgot the name. If I come across, I will send it to you. So there is a software which is always giving this 360-degree supervision of that area. So that software, I don't know whether it's freely available or we have to pay. So when information I get, I will send it to you. Thank you, sir.
I think the one I was talking to you, mentioning that the software which can track the IP address. I don't know whether this, let's say through Google, we can see whether the two people are sitting. The IP address cannot do that. So we have to improve on that. I'm sure students would find another way of handling that.
Yeah, cheaters are always there.
Yeah. So any other comments or questions?
Assalamu alaikum, Dr. Sher. I want to ask a question, if you please allow me.
Yeah, please, Dr. Sajid Rashid.
Yes, I am Dr. Sajid from Rawalpindi Medical University, Rawalpindi, and also student of health professions education and working as assistant professor of surgery. I have one question after listening all this discussion and very good presentation of yours. My one question is, what about the legal issue? Is this at the moment allowed to take high-stake exit exams by using this online assessment?
Yes, I think that's very, very important aspect, which I mentioned. Now, different countries have taken steps on that. I can quote the Malaysian Medical Council. Malaysian Medical Council has issued the instructions and guidelines, and as I said, that they for the hands-on examination, they have deferred it. They say, okay, if it's a year 3 student, you can promote to year 4, subject to their clearance of the clinical examination later on, whenever they join. But the sum of part of the examination, and especially the written one and communication and some OSCE or OSCE, we are conducting. But the real hands-on part is being deferred, and the student must clear that to continue into the senior class. So I'm not sure if PMDC has issued any instructions on that. Because I think it is the responsibility of medical councils of the country. They have to realize the situation and come up. So legal issue, as you said, is very, very important. The stakeholders, the Ministry of Health, the medical councils, they have to come up with some suggestions about that. There's no doubt about that. Whatever method we use must be acceptable to these bodies.
Thank you, sir. I think, sir, some sort of legislation at the level of different countries, their assemblies, that is also required, and also legislation from platform of the...
You might know what happened in UK. For example, there the government and the GMC, they promoted their final year students. They passed them, and they asked them to come and actually help in actually management of the patients, especially the systems where continuous assessment is quite solid, and they are doing really thoroughly. they may feel that based on the continuous assessment, they can have a exit result. But again, it depends in different countries, and many councils have dealt it differently. But what I know in UK is that the final year students, they were actually declared pass and asked to come and help in the hospital under these circumstances as junior house officers.
Thank you, sir.
Any other question or comment?
Assalamu alaikum, sir. This is Dr. Amna Farooqi from Islamabad Medical and Dental College. I'm from the Department of Physiology. Now, we were talking about vivas right now, taking them online. We take structured vivas. So how can we repeat the same viva questions for the students coming later on? Because they might have been already told those questions by the previous
Yes, yeah, very, very important. One way could be, I mean, it's just a knee-jerk kind of response. One could be that if, let's say, you have 4 students, you can have a viva 4 students together by different examiners at the same time.
Okay.
So the 4 examiners are having Zoom session with 4 students at the same time. That, I mean, that can be a quick response to that. That question or that situation.
Okay, thank you, sir. Thank you.
Yeah, any other comments?
Hello.
Yes, please.
Sir, hello, Dr. Mir Ali Shah from Peshawar. Hello.
Yes, please.
Hello.
Yes, we can hear you clearly. Dr. Mir Ali.
Yeah, Mir Ali Shah, Professor of Ophthalmology, Peshawar.
Yeah, we can hear you very
in one of the slide, we could see that for 20 to 25 students are examining, there is one invigilator, right?
Right.
There is one invigilator.
That's right.
So this one invigilator is online observing them, or it's face-to-face contact?
No, it's online. Like, for example, now on my screen, I have, let's say, 20 or 25 people, and I can see everybody. So if you feel that this number is too much, you can reduce it. Yeah. So, I mean, it depends how many students you can...
It's something.
Yeah. It depends how many students you feel comfortable to invigilate at one time. And so we make small groups. Each group has an invigilator, and they start the exam at the same time. And
okay, all the groups will be at the same time. Yeah.
Yes.
Oh, okay. Thank you very much. Otherwise, there is a chance.
No.
Yeah, the material will be leaked. Yeah.
Yeah, all the groups at the same time, but in different groups.
Thank you very much, sir.
Yeah. Okay.
Signal problem.
Any other comments or questions?
Sir, I have got a question. Actually, I'm Dr. J.M. Kibria from UPNM.
Yes,
Just now you
Dr.
told
Kibria.
that maybe 4 students may be taken viva by 4 4 examiner.
Right.
So in that case, the marking, marking from one examiner may not be same like that of the other marking. So in that case, should we make it only pass and fail, or we should give the marking?
Sir, if you see, we were talking about a structured viva. If there is a structured viva, there is a structured questions, and there is a structured marking scheme. Now, examiner difference is always there. But if we have a structured viva and a marking scheme, I think we can cover that aspect.
Amna, dekho nano ka chala rahi ho.
Please, those who others, if they can unmute. Okay, now I have a couple of more
Can I
slides.
have a question?
Yes, please.
What's best way if I have like I want to put slides and want students to answer immediately, give them choice or right, such as 20 or 31.
Right.
What's the best tool to use?
I mean, there are softwares, but otherwise you can do very simply. That's what I just did. If your slide is very clear, you can put it on the PowerPoint and you can show to the students and they can answer the way we just put up the question.
What I see, even in Zoom, I saw sometimes in webinar, they put MCQs, choices, we answer on the screen. How they do this?
Yeah, that is possible. It is using a like survey questionnaire, like what I said. For example, you can use Google Forms as well, but they are more useful for surveys rather than for conducting the exams.
Okay, thank you.
But that can be used. Can I share just a couple of more slides with you? I can go on. Okay, now the one is the announcement for next webinar, which would be on 26th of July, and it is on blended learning, balance in blended learning, and I hope that you can join me that. And another is a very important, and I really want you to consider that. This is a proposal proposal from my team. May I propose to each participant to donate $1 or equivalent amount in your local currency to any deserving individual in your neighborhood or any public welfare organization in your community after attending every webinar conducted from this platform. So I would propose and request that each one who is attending this webinar, if can follow this and just donate equivalent to $1 to any deserving candidate or any community. So that would be a charity drive from this MEDED webinar series. I hope that I can get a good response on that. You don't have to report to anybody. Just donate if you can. With that, I thank everybody for your participation and for your cooperation, and I hope to get that kind of cooperation in future as well, inshallah.
Sir, can I
yeah, please.
Yes, I would like to share with you an experience about the Viva and how to manage a large number of students and conducting Viva online, structured Viva, not just the old one. Viva.
Right.
So what we did in Hawler Medical University, Kurdistan region, Iraq, we have around 150 students, and we divide our staffs to 18 committees composed of 4 members each committee.
Okay.
The committees came to the college with the social distancing and self-protective measure, but the students were at their home. We conduct the online.
Right.
And what we did, the first question were similar in all 18 committees.
Okay.
So this to decrease the cheating
right.
between the students.
Right.
So this was our experience, and it was successful.
Yeah, I think that's very good, and is the example that we were talking about, that if we have structured Viva, means that the questions are already decided and every examiner is going to ask the same question, and there is a marking scheme, and hopefully the Viva student number would not be so great, so it can be conducted at the same time. And if the number of students is too many, then we can have multiple sessions, but not exactly the same question, but we can have similar questions. So there are ways of going around it. I think with that
one
we
suggestion
come.
from me.
Yes, please. Professor Iqbal.
I am Professor Iqbal Mughal. I am Professor of Forensic Medicine at Central Park Medical College. There is a query repeatedly regarding the conduction of Viva on Zoom. In the Zoom, I give you an experience that there is a function of waiting room. So
Right.
all students, you are focused to take the Viva on that particular occasion. For example, 20 student, 30, 40, whatsoever the number you want to take up for the Viva, you ask the students to enter into the waiting room, and
Right.
then from the active room you allow the student one by one by clicking on particular roll number or name of the student to enter into the active room, and then you can ask any sort of question, 1, 2, 3, 4, 5, or these questions may be structured because the students sitting in the waiting room, they will not listen these questions. So when you complete your Viva, you make the student to exit or you remove the student from your active room, and then you call the next student from the waiting to enter into the active room. That is the solution in which
Thank you very much, Prof. Iqbal. Actually, I have used that. But actually, when the students are in waiting, you cannot stop them from communicating to others. They can still communicate to other people. So it may not be really a foolproof approach, because while they are waiting, because you cannot see them, they are waiting and they can communicate through any means to any other person.
But that happens in face-to-face Viva as well. I remember when we were students, we used to do the same thing. The person who's coming out of the room of the Viva and we are waiting eyesight, that is exactly what we used to do. And
Madam, time has passed.
Sir, we still did this. I gave my exam and Viva on Zoom, and the teacher had used the breakup rooms on Zoom. And the moment we were out of the breakup, whoever was giving the Viva first, we shared the questions on the WhatsApp group, and this is what we did as students.
Madam, we have.
Can I comment one thing?
We have moved from there. The student who is coming out of the Viva room is quarantined, so we don't let them. We don't let them meet with the.
Yes, sir, but sir, we can have a lot of pool of questions so that questions are shuffled, and the next student does not have the same set of 5 questions or 4 questions that one student has asked.
Can I answer, please?
Yes, please.
So if we take the mobile from them, then we can closely monitor those people. We can easily go through on the same process which the Madam Rabia.
Personally, I see Viva not a major problem that can be managed very easily, but as compared to written examination online, that is probably more difficult to manage. But Viva should not be an issue. There are a number of ways of managing that. Yes, Prof. Loach.
Sir, the discussion is quite going fine. I would like to add something on what I was just telling you earlier regarding the cat. I found
Professor Bloch can't hear you.
Pardon, sir?
Can't hear you. Okay, unfortunately, we can't hear Professor Bloch. Maybe we can discuss sometimes later. May I thank everybody for your time and support and a lot of discussion. Really, every time I conduct this session, I learn a lot of things from all of you. We always leave wiser after having such discussions. And
one question. Can we register again for your next session?
Yeah, I will send information about that. I will, Yeah, as long as your name is in this group, you will get that notification. With that, thank you very much, everybody.
Thank you very much, sir.
Thank you.
Thank you, sir, and assalamu alaikum.
Wa alaikum assalam.
Goodbye.
Assalamu alaikum ji, fi amanillah.
Fi amanillah. Thank you very
Assalamu
much.
alaikum, Prof. Assalamu alaikum, Prof.
Thank you.
Thank you very much.